Hello and welcome to the NHIS Campus Connect Podcast. Today, we are coming to you from the University of Education, Winneba, UEW, where the NHIS Campus Connect initiative is engaging students and bringing health insurance services directly onto campus. I am joined by two students from UEW to talk about what this initiative means for students and why NHIS matters more than we sometimes realize. My name is Shanice Palm, your host. Let's get into it. So first, I want them to introduce themselves, the program, the level they are in, and what's something fun about campus you cannot do with us. Let's start with you.
Okay, thank you. I am Asante Wakuto, a level 300 students from the Department of Geography Education.
Okay.
Talking of one thing I can't do without on campus, I'm going to talk of the friendship and the networking opportunities on campus.
That's nice. What about you?
Okay, my name is Frimpong Samuel Jr.,
Okay.
a political science student, level 200. One thing, it's obvious we cannot do without on campus. I'm talking for the boys. I mean, Gobe is manageable. Yes.
Gobe is very important.
Yeah, very important. You cannot do without. So, from the boys, Gobe. Yes.
That's nice. Okay, so Asantwa and Frimpong, you're welcome.
Thank you very much.
Asantwa, I want to start with you. What was your first reaction when you heard NHIS Campus Connect was visiting EUW?
Okay, I was not just excited because for the fact that students have been thought of and then the initiative was brought directly to our doorsteps meant that students' health was really important, or it really mattered. So I was very excited about the whole initiative.
Frimpong, what about you? Do you think bringing the NHIS services to campus makes any difference compared visiting our offices?
It has been an amazing or tremendous, mark, because initially, if you wanted to register for our NHIS card, it's either we go to the office. Now that it's on campus, it's convenient, time saving as well, because there's no way a student will miss class and leave to go outside campus just to register. You understand? So it's time saving, it's very convenient as well. So I think it's a very good thing.
Okay, so I want to ask you, Frimpong, do you have any experience with using the NHIS?
Okay, me personally, I think I wouldn't brag, but it has been a while since I felt sick. But I can remember last semester, my roommate, he felt very ill. And when we got to the hospital, we thought we were going to, spend our money on the bills. But we got amazed. The nurses said only if he had an NHIS card, it could, cover some bills. That was when I was really relieved, because, come on, I cannot, spend all my money on bills.
How much do they give you?
Yeah.
What about you, Asantwa?
Okay, personally, I have an experience. So I went to the hospital and I didn't know my card was out of date. And so I was just sick. I wanted to go for treatment. When I went, unfortunately, I was told it had expired. So I was asked to pay an amount. But because I had access to my phone, I just had to dial the short code, *92. What's it?
*929
929 hash. Yes, and then I renewed it because it was not up to a month. So instantly, it started working, and then I had access to my healthcare. So I think it's a good thing.
Okay, so aside the experiences both of you have using the card, and prior to we visiting your campus, what did you know about the scheme?
Okay, we've heard a lot.
You in particular?
Yeah, so I've heard a lot personally, and then I would say it's accessible to all children, the aged, everybody could just have access to it. So I think that's one thing, or the basic thing I know about the scheme.
Frimpong, what about you?
We have heard a lot. I'll do with the misconception first.
Okay, great.
Personally, I thought it was for the aged and for kids. Yes.
Don't they all think that?
Yeah, that's what I thought, it was for the aged and kids. But we had a program not long ago, and I think we were educated on the basis that it's important everybody got themselves an NHIS card. Yes, it's very convenient, and it's supposedly you are caught up in an emergency and you don't have money on you, the NHIS card is supposed to cover up some bills.
Yes, the NHIS card is able to cover up some bills for you. I just ended Beyond the Degree conference that you had. One of the guest speakers was the CEO for the NHIS, for the National Health Insurance Authority, sorry. With the address that he gave, what was your key takeaway that you had from his address?
He said so many things, but the one that caught my attention was, he said, so far as we are student leaders, being responsible isn't always about, keeping track of your finances. But so far as you're a student leader and you are made to, lead, you're supposed to take your health very serious. That really made hold of me, and I think I will never forget that one. So I'm supposed to be able to keep track of not only my finance, but my health as well.
Yes. Asantua, was there anything that he said that stood out?
Okay, so I would also talk about he mentioned the mandate of NHIA, and especially the scheme. Yeah, sure. So
do you remember what the mandate is?
Yeah, sure. I remember one that says it ensures equitable access to all, and I would attest to that fact because both the poor and the rich have access to healthcare with NHIA. So I think
Okay, I want to ask both of you this question, but I want to start with Frimpong. Do you think, hearing from the leadership of the authority, do you think health insurance is something that should be taken very serious, especially at this youthful stage you find yourself in?
Very sure.
Okay,
yes,
why?
I think we being the youth, we focus on finance rather than health. And we all can attest to the fact that if you're not strong enough, you cannot go outside and make a living for yourself.
Yeah.
For that reason, we getting our hands on the NHIS card, it's very beneficial. Yes. Yeah. And it shouldn't be hindered from the public. I think the education must go far and people must adhere to it, so far as it's our health.
That's all about you.
So I think at this stage, I'm not going to spend so much on healthcare because if I'm supposed to pay thousands of cedis for healthcare, I think I cannot afford at my age, and so it would help me save
for the future.
The future, because I'm not going to spend that huge amount of money on healthcare.
Because National Health Insurance will get you covered.
Covered.
Okay, in one sentence, both of you, what's the importance of NHIS Campus Connect here on the UEW campus and other tertiary schools? Okay,
I think my brother mentioned some misconceptions, so I think now it has been cleared, so we are cool. We know the realities on ground, and now we understand that student health also matter because we are the future generation. And so if we understand that we have the NHI and we can take advantage of that, I think it will be good. And whenever we are ill, the cost involved with health treatment would not be would not be a hindrance, or would not be the reason why we would be scared to go to the hospital.
What about you, Frimpong?
For me, the NHIS Campus Connect being here on campus, it has been convenient, time saving. As I mentioned earlier, we were supposed to, in most tertiary institutions, the students are supposed to go outside and enjoy the services. But right now, right here, I can say that since we have a Campus Connect, students would be able to, from the convenience, and there is a short code.
Yes.
That one as well.
Please educate them. What's the short code?
I think *929#.
Yes.
Yes. So with the comfort, the person being in the comfort of his or her room, she can just renew and enjoy some services.
And also, you can also link the Ghana card,
yeah,
and also subscribe to the auto renewal subscription.
My NHIS card is actually missing, so for 2 years now, it's the Ghana card.
It's the Ghana.
Use,
oh, okay. What about you?
I even have a shot of it on my phone. When I go, they just need the code, and I'm good to go.
That's great. That's great. That's great. To every student listening or watching, Your health is one of the most important investments you can make while pursuing your education. The NHIS Campus Connect initiative is here to ensure students are informed, protected, and able to access healthcare when they need it. So if NHIS comes to your campus, register, renew your membership, ask questions, and learn more. Follow us on all social media handles displayed on your screen, or do visit our website www.nhis.gov.gh for more information. This has been the NHIS Campus Connect podcast, and I did this with Asantua and Frimpong. Thank you so much for spending your time with us.
Thank you for having us.
You're welcome. My name is Shanice Palm.